Hello, everyone. This is Dr. Mike Cho, a physical therapist. And yes, we are here in our Jerry Stretch program. We're going to be talking about 7 best stretches for lower back pain and stiffness. We'll be back in a few seconds, okay? All right, we are back. So let me just share my screen with you, ladies and gentlemen. So this is what you call back stretches. Let me just play that little video that we have. This is courtesy of medbridgeeducation.com. So you basically sit down on a chair, right? You get a little ball like that, not little, like a yoga ball, and then you slightly sit at the edge of the chair. And you lean forward. Of course, if you don't have enough trunk control, don't do this. But this is how you stretch your low back area. You move forward and back. There you go. You can also extend your knees to have some hamstring stretches, but start this maybe 3 sets of 10 for your back, and slowly but surely, there you go. Stretch that. Of course, don't move forward. Don't lean too much forward so you don't get dizzy. When you also do this, let me replay it. When you also do this, try to look up straight. Don't look down, because when you look down, crystals in your ear, you could get dizzy and fall forward. So try to look up straight, and then stretching that low back area. I actually think I need to do this too. So, all right. So do this 3 sets of 10. You can also hold it towards the end, feel that stretch. Of course, if you don't have a yoga ball like this, you can use another chair to roll, moving forward, like a rolling chair or just a regular chair that you can reach forward and push and back, push and pull. All right. So let me remove the share screen. Let's go to the next video that we can share for the back. Let me make this bigger real quick. Well, I'm gonna make this bigger. Hold on. And let's make this bigger here. Put that thing down. Then this side here, this video here, is basically same thing. It's a seated thoracic, rotation. So you're basically moving forward, but you're rotating your trunk too. So let's go ahead and watch this video real quick. So again, sit on the chair, a sturdy chair. There's a ball. If you don't have a ball, go buy at Amazon, obviously, or there's another chair. And then basically you're trying to reach towards the side. You're basically stretching the other side too. I think I need this to myself. I need to be demonstrating it myself, right? So you're rolling side to side. You're not just stretching your low back when you're leaning forward like this. You're also stretching your lats. Lats means the side, the latissimus dorsi, the side of your back that basically pulls down your shoulder area. Let's go repeat that video so that way you can see it. Do 3 sets of 10 on this too. You can probably hold towards the end while you're reaching towards the end. All right. Of course, if you get dizzy, obviously stop, right? There you go. You're stretching your lats, you're stretching your triceps. Hold it there for a good second or two. In that way, you get that stretch for your low back and your lats and your triceps. All right. When you get dizzy, obviously you stop. And if you need more guidance, obviously we can do telehealth with you, or reach out to your local therapist or physician so they could teach you the proper way of stretching. Okay. All right. So check that out. 3 sets of 10. And then let me stop my share screen there. So, like what I said, when you're reaching there, you can put one hand over the other and stretching towards that side, right? Stretching over that side. Okay. Let's go ahead and move on to the other program. Where did that go? Next is the lumbar flexion stretch. All right, let me turn this off. Let's make this bigger. Obviously, let's do the presentation. Share that screen again. Home program. Well, we gotta make it bigger, right? So, where did that go? There you go. So, lumbar stretch. Let's go ahead. Of course, if you get dizzy, you obviously stop. Okay. Right? So you sit down, obviously in a good chair, sturdy chair. You're reaching down there. You see this gentleman doing. Of course, if you get dizzy, you stop. Okay, especially if you got vertigo or BPPB or benign paroxysmal positional vertigo. This one, you're just stretching that low back area. All right, in that area here. I don't know if you see my little mouse on this area here. Let me play it again. So you sit, you keep your feet apart. All right, you got space, wide base of support. You're leaning forward. Some people even try to put their palm on the floor, but this is going to stretch your low back area. Obviously, if you get dizzy, don't do it. You got to talk to your doctor or physical therapist, and you just sit up there. So when you go there, try to hold it for a good second or two, 5 seconds. And when you go, remember there are two types of muscle contraction when you do this: the concentric, which is going down, or of course the gravity is pulling you down, and of course when you try to sit up, you're also doing some muscle contraction there, both concentric and eccentric. All right, so there you go. Of course, like what I said, if you get dizzy, you obviously stop. All right, you don't want to keep going and get dizzy. All right, let's go ahead and move on to the next stretch. Where did that go? Let me make this smaller. The next is thoracic extension. You're sitting. Oh, I gotta share that screen too. All right, so you're sitting. All right, I need to be doing this with you guys. Or you sit and you got your hands behind your neck, and then you kind of extend that back. Try to, I like doing this, stretching those pecs, your pectoralis, your chest muscle. All right, you're expanding it. Of course, I can't reach my back of my chair, but if you got a somewhere a mid back chair, that's going to be good too, to put pressure on the back part, thoracic area. Let me repeat that again. You do 3 sets of 10. You try to hold it at the back. Oh, I need this too. All right, there you go. Of course, if you get dizzy, you stop, right? You stop stretching. The good thing about, you want to put that hand behind your neck, if you're kind of putting some pressure on the base of your occiput too, or the base of your skull, you're kind of putting pressure, you're kind of distracting that skull too. All right, you're distracting that base there. Of course, when you open and expand that chest, you're expanding that chest too. Oh gosh, I need this too. All right. So there's the next exercise that you can do, 3 sets of 10. Of course, if you look up and you get dizzy, obviously you got to talk to your doctor, your physical therapist, and that way they can see if it's true benign paroxysmal positional vertigo, or you're just weak, or you're just dizzy, or you're dehydrated or something. All right. So do 3 sets of 10 on that. All right. Let me stop this share screen. If you're learning, type in your learning. Let me oops. I think I logged out on that program. So next is we're gonna do the step back shoulder exercises, or shoulder stretch. I should have shared this thing. All right. Again, the videos are courtesy of medbridgeeducation.com, medbridge.com. Use the code alternative if you want to get CEUs, and of course, access all this home exercise program. If you're a clinician, if you're a client or a patient who wants the personalized program, reach out to us too. We can do a telehealth consult with you, and then personalize those exercises for you. All right. So again, this is the shoulder. Basically, you step back a little bit. There you go. I hope you're stepping back. There you go. And then stretch that back there. You're making sure it's a 90-degree angle there. You're stretching your hips, the back part of your hips, your hamstring, your lats area. Of course, if you get dizzy, you stop. And of course, don't put too much pressure on the hand. That way, the chair is not going to tilt backwards. So just stretching that. Of course, if you can't do this, consult a therapist, consult your physician. But this is a good way to stretch your hips, the back part of your hamstring. All right, and of course your lats right over here. All right, there you go. And of course, as much as possible, this he's a younger gentleman, but if you get dizzy, try to look up, and that way your crystals are still not going out. Okay, so making sure you got the right posture and right stretch. Don't overdo it. 3 sets of 10. Hold for a good second or two. There you go. He's holding it like 1, 2, 3, 4, 5 seconds, and then boom. All right, do 3 sets of 10. All right, where did that? Let me take that off. Again, remember, these are for general exercises. We got like two more exercise that you can, or one more, I guess. Well, the other one is the same, standing thoracic spine stretch. Oh, this is more for the thoracic area. Where did that go? Okay, let me make that bigger. This is a female, a lady, and then of course there's a chair. I hope I'm sharing the screen right. Right, you're leaning forward. This one she didn't step back. It just leaned forward there. Of course, it's still loading. And then stretching almost the same, but basically coming from a standing position, and she reached out to that chair and stretching that thoracic area. Well, basically you're also stretching your lumbar and shoulder area. Let me repeat that. So the difference between the other person, the gentleman earlier, he kind of stepped back and stretch while his hand was already on that chair. But this one, she's standing up, leaning forward, eccentrically extending, or extending her muscles on the back. There's the several types of muscle contraction. This one is more like an eccentric movement, wherein the gravity is trying to pull her down, and then it stretches at the back. Eccentric there. All right, stretching the hamstring, stretching the thoracic area, and then bam, hold it for a good, 5 seconds. 1, 2, 3, 4, 5, and then boom, she kind of stood back up there, and then boom. All right, stretching, very important. The key here is you're moving. The key here is you're doing it. All right, because we can show all the videos, just like me, right? I'm showing the video, but I'm not even stretching it, but stretch, doing it religiously. Okay. All right, let's do the last one for your seated upper thoracic exercise. All right, let's go ahead and share it. And then let's go ahead and play the video. There you go. He's sitting. There you go. He's got his hand behind his neck. I think I can do this right here. And he's opening up that chest, extending. There you go. And just open it. Try to squeeze your shoulder blades behind you. And you're just opening up that chest. All right. Hold it for a good 5-10 seconds. And then back in. This is especially good for those people who are just sitting down all the time. All right. Squeeze that shoulder blade. And then back in. All right. And then expand, open up that chest. Most of us, we're like sitting down all the time like this, and our chests are compressed. All right. And then, of course, when your chests are compressed or you're kyphotic and you don't have a good breathing technique, this one is a good way to open. Of course, if you can't put your hands behind your neck, you can just put it behind, just right on the side, and just extend and squeezing that shoulder blade. Let me try to repeat. This one's supposed to repeat automatically, but yeah, squeeze again. If you can't put your hand behind your neck, put your hands on the sides, just squeezing that shoulder blade, opening up that chest area. All right, so these are some of the exercises you can do at home, obviously. And of course, those people who kind of signed up from the alternative career group, you can do this also while you're sitting down in your chair doing your paperwork. Of course, if you are doing home health, you can do the stretches with your patients too. All right. And then let me stop my share screen there. All right, remove. All right, again, if you are interested in having a one-on-one telehealth program with us, reach out, go to our website, or call our office, set up a telehealth appointment, or you can go to the clinic or watch the videos. And of course, if you're a clinician, check out medbridgeeducation.com. But before I let you go, let me just show you this real quick video from Ultimate Workout.
Hey everybody, I'm Chad Brock for Ultimate Workout and Recovery, and I have a specific group of people I want to say hello to. And that is the folks out there who are a little bit elderly, maybe sitting in a wheelchair, and you feel like you can't do anything. Maybe you have muscles that don't work like they used to. But guess what? Muscle has memory. All you need to do is start again. You can build back your muscle, you can build back your cardio, you can build back things that you thought you were without. And guess what? You don't have to have somebody there to do it with you. You can use Ultimate Workout and Recovery on a daily basis and just see how you feel. I guarantee you will feel great. Absolutely. When it gets down to it, everybody knows it ain't the smoke, it's the
All right. Again, thank you very much, Ultimate Workout and Recovery. Appreciate you. And before I let you go, always remember the word fast, FAST. I'm not saying that you do your stretches fast, take your time, but FAST, letter F, find people that will bring out the best in you because you are the average of the five people you hang out with. So if you want to stretch, go to our clinic. You got people there who stretches like every Tuesday and Thursday, or watch these videos. Find those people who will bring out the best in you. Next letter is take action. All this stuff that we're doing, it's free. We provide this value to our group, to our patients, to our clients. Just take action. That way you can get better and stronger. Same thing with therapy. We have our clinic both in Jackson and also in Paris. The clients that we go there, that we see there, are taking action. They're doing better. They're moving, and some of them, they're probably stronger than me now. It's like so strong, flexible and everything, because they are taking action every single time. They do the home exercise program that we're doing, and also they're doing their one-on-one therapy with our therapy team there. Next letter is, of course, share and subscribe. The more shares, the better. And last but not least is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually going to understand it more. So the stuff that you're learning right now, teach it also to other people. Hey, I learned this stretches from Dr. Mike or Jerry Hab or my therapist at Jerry Hab, and they taught me how to properly stretch. Teach it to other people. Now, of course, if you don't feel like you're qualified, tell them, hey, go to Dr. Mike and Jerry Hab and Terry, the rest of the people, our therapist, and we will teach you. All right. Again, thank you very much. Be awesome, be great, be excellent, and we'll see you around on the next stretch session here at Jerry Hab Stretching Group. Bye bye.